Good afternoon. My name is Andrea Strohmeyer, and I am a science educator with the Health Museum located in Houston, Texas, in case any of you are joining from out of town. This is an ongoing series that we have with the Menninger Clinic called Parents. Let's talk about mental health. And today's topic is Asian Americans and addictive behaviors, what no one wants to talk about, with Doctors Kelly Truong and Doctors Shetal Amin. I got it. It took me a second, but I got it. So I'll give everybody one more minute or two to come on in. Please note that this session is being recorded. Please leave your videos off and leave yourselves on mute. Questions can be found at the Q&A box on the bottom of your Zoom toolbar. You are welcome to type questions as we go. I will read them to the doctors at the end of this session. All right, doctors, y'all are welcome to take it away.
Hi, everyone. I'll start by introducing myself. I'm Dr. Truong. I'm an addiction psychiatrist at the Menninger Clinic. And I'm really excited to talk to you all about this important topic that really no one wants to talk about. And that's our topic. And and we have Dr. Shetal Amin, who I'd like to introduce as well.
Hi, everyone.
So Dr. Amin, would you like to introduce yourself and tell everyone what your role is?
Sure. Hi, I'm an addiction psychiatry fellow at Baylor College of Medicine, and really happy to be here today and talk about this very important topic.
So today, we're really hoping to help us together as a community examine the cultural factors that affect the AAPI community's approach to mental health treatment, and discuss the impact of specifically alcohol and nicotine use at the AAPI population. So we are trying to focus primarily on alcohol and nicotine use disorders in this presentation. And hopefully at the end of the presentation that parents and caregivers, as well as clinicians who are attending today, will have an idea of how to talk to your loved ones and care for the mental health of your children and yourselves. So some definitions. What do we mean when we talk about mental illness? So it's a condition that affects a person's thinking, feeling, mood, or behavior in ways that causes problems in the person's daily life. So this is not, feeling sad when something sad happens or feeling angry when something that should be angering you happens. But it's like a persistent emotional changes that prevent you from doing your work, prevent you from feeling more like yourself, and even functioning in your relationships. So some examples of mental illness is anxiety, depression, personality disorders, substance use disorders, bipolar disorders, and schizophrenia. So in this presentation, we'll focus on substance use disorders. So what is a substance use disorder? So substances refer to really any psychoactive substance. It could be caffeine, it could be alcohol, it could be tobacco. And there are lots of definitions for addictions or substance use disorders. We like this one. It's a powerful motivation to use a substance despite persistent problems associated with the substance use. So this means that if you try something once and it's really not causing you problems, that doesn't mean you have a substance use disorder. When you remember 3 C's, there's a loss of control. So you're using it even when you don't want to. You're using more than you intended to. And craving, when you're not using it, you're really thinking about it. You're really seeking it out. And negative consequences. So the substance use is preventing you from doing your work, engaging with your family members, engaging within other relationships, or doing things that you generally would have enjoyed without the substance. So how do substance use disorders and mental illness affect the AAPI community? So in the United States, about 6.1% identifies as Asian American or Pacific Islander. And of those, 15% reported having a mental illness in the past year. That's more than the number of dentists, teachers, and lawyers in the United States combined. So this is a really significant number. And we'll look at some trends in the past few years. Now, this is a 2016 to 2019 data. And what we're seeing is that severe depression, so depression that is causing significant problems in your daily life, is increasing in the Asian American community. Pretty much mostly across the board in all age groups. And among substance use disorders, 1 in 7 AAPI members has a substance use disorder. And a lot of people, 2.1% of adults had both a substance use disorder and a mental illness. And this affects, well, suicide. That's one of our biggest concerns here at the Menninger Clinic, is how to help someone going through a lot of despair, a lot of changes in their lives, and of course, suicidal thoughts. So we're actually seeing here, as you can see, an increase between 2009 and 2019 in suicidal thoughts, ideation, attempts, and a plan within the AAPI community. So what is the link between substance use disorders and suicide? We actually know that if you're using a substance, it's affecting your brain in ways that increases your risk of generally risky behaviors, self-harm behaviors. So we're seeing a significant link between suicidal thoughts and substance use disorders, as you can see here. And this is particularly in the AAPI community. In all communities, I'm sorry, let me rephrase, in all communities, but this data is looking specifically at the AAPI community in 2019. So some key points from this data: mental health concerns such as depression, suicide, and substance use are increasing in the AAPI population and cause tremendous impairment. But it's not something that we're often talking about until recently, because of all of the efforts made by mental health clinicians to raise awareness about this issue. And substance use disorders are associated with suicidal thoughts and behaviors among AAPI adults. And what we also know is that contrary to some beliefs about the model minority stereotypes, that Asian Americans don't experience all these negative consequences or substance use disorders or mental illness, that we're really hardworking and we're constantly achieving and we're successful. Contrary to that stereotype, AAPI individuals with substance use disorders suffer the same consequences, and unfortunately is often hidden from their family members. So homelessness, arrests, hospitalizations are often more hidden in the AAPI community. Actually, in 2019, among AAPI individuals age 12 and older who needed treatment for substance use disorder, 93.1% did not receive treatment. That's a huge number of people who would have benefited from help, but did not receive it. So we're going to look at some reasons why that is. So there are significant barriers to treatment, and some of that is internal, so internal motivations of the person, as well as external factors. And the number one reason that we've identified is shame in the AAPI community, in acknowledging that you need help, acknowledging that you have any issues at all. There's a significant stigma toward mental health issues, and especially addictive disorders, because it's seen as a weakness or a lack of willpower. So oftentimes, these individuals are hiding their pain, and they're hiding everything that they're going through. And sometimes when they are expressing themselves to their family members, there's generally a sense of a need to handle the problems within the family for fear of losing face. There's also a lack of recognition of mental health issues and addictive disorders in the AAPI community. So a lot of individuals may be experiencing anxiety, depression, alcohol use, but instead of saying that they're experiencing emotional concerns, they may go to the doctor and say, well, I have a headache, I have a stomach ache. So reporting physical symptoms feel safer for individuals in the AAPI community. And there are also language and cultural barriers. So we know that clinics or hospitals that don't have language services, it's really hard to be able to communicate with someone about their mental health when they're not communicating with someone that speaks their language. There's also some fear of prejudice and discrimination in certain AAPI communities. So we're talking about the AAPI community as a whole right now, but as we'll see later on in the presentation, that there are specific subgroups and there's a lot of diversity in the community. So studies have found that there's fear of prejudice and discrimination, particularly in the Filipino community. And some people have a general distrust of Western treatments. They don't know if it's really effective. I mean, there's a question of, is that really a thing? One, is mental health really a thing? And if I do have mental health concerns, is the treatment really effective? And sometimes there's a complete lack of awareness that there is such a thing as treatment. So I've actually met many Asian Americans who really lived with their pain for a long time, not knowing that there was really any way out of it. In fact, that it became sort of an incorporation into their identity and part of their lives. And I spoke briefly about the model minority stereotype, but this is really important because we all hold specific biases toward different populations, even often unconscious. So we may hold biases without realizing it. And sometimes clinicians are not always fully aware that these issues may be affecting their patients because they may believe in the model minority stereotype. So that means that when you go to a doctor, they might not be asking you all these questions about substance use disorders because there's a general assumption that you may not be struggling with these things. And then lastly, some practical barriers are cost and lack of insurance. Just navigating the healthcare system as a whole, especially for non-English speaking community members or immigrants, new immigrants, it's very difficult. So these are the barriers that have been identified both in the literature and also I think in everyday clinical setting that I've definitely encountered. So these are some example beliefs in specific communities. So sometimes some Chinese members might feel that mental illness is due to a lack of harmony of emotions or caused by evil spirits. And a coping behavior might be going to get acupuncture, going to different healers. Now, I'm not saying that some of these won't work, but sometimes they may be missing the underlying issue. Koreans may believe that it's bad luck. Sometimes you're experiencing mental illness because you're getting payback. And some of the common behaviors might be denying the problems or showing signs through nonverbal communication. So that's through some physical symptoms. And I'm Vietnamese, so I see this a lot, like that depression is just sadness, it's going to go away. Or it's seen as just not normal or crazy. And sometimes people then might suggest that you try some home remedies, Chinese herbs, or more commonly, especially in my family, just stop feeling depressed. If you stop feeling depressed, then you won't be depressed. South Asian Indians, it's on your head, just a weakness. There were studies showing that some South Asian Indians hide feelings to preserve izzat, which is honor. And some South Asians and Pakistanis experience depression as physical symptoms, so feeling that their heart is sinking. And there's also a syndrome called DAT syndrome, where a male, usually a male member, will feel that they become very anxious that they're losing their semen, and semen representing their vitality. They're losing their energy and their life energy. And they may seek help through herbal remedies, or they may seek help through a primary care physician for these physical symptoms they experience. Now, these are just examples, so it's not meant to completely generalize to all of the AAPI community. So there are some differences in the way that AAPI culture is generally, as well as compared to the Western culture. And this is really important for understanding why it may be so difficult for the AAPI community to seek help. So we generally identify with the collectivist culture, whereas family-oriented, there's a lot of emphasis on interpersonal relationships. So your relationships within your family, your role within the family. There's also a lot of hierarchy. So elders, aunts and uncles, they may have more decision-making power in the family. And sometimes they may be the ones making the decision whether you go to treatment or not. But in general, the AAPI community really deeply cares about how their behaviors will reflect on their family. There's also a general suppression of emotions. So not showing emotions is considered a positive. Whereas in comparison to Western culture, it's much more individually oriented. There's an emphasis on self-fulfillment. So you're feeling you're doing things for yourself and not necessarily so much to reflect on your family members. There's also an emphasis on egalitarian relationships. So equal relationships and equal decision-making power in the family, oftentimes. And there's also a value on expression of emotions. It's considered a positive, in fact, a sign of bravery and vulnerability when you express your emotions openly. So these differences make a huge amount of emphasis and impact when it comes to AAPI community members seeking care. So here I'm going to transfer to Dr. Amin to talk about some of the more specifics of substances.
Okay, so we're going to spend some time talking about, like Dr. Truong said, more specific substances that your child might come in contact with, and what we should know about it, and come from a really curious place of learning and understanding. So the first one is nicotine. Nicotine is a plant alkaloid, and how it works on our brains is as a psychostimulant. So it works by kind of activating, and it also can modulate our mood, which is an important piece, which I'm going to talk about in a second. How do people use nicotine? Traditionally, smoking cigarettes. It's one of the hundreds of chemicals that are kind of incorporated into the cigarette. But now more and more what we're seeing is this transfer of nicotine from cigarettes to the vaping world, with vapes becoming much more common, being sold at many shops throughout cities, but also in things like gas stations where they're really accessible and available for our children. Perceived risk is a really important piece here. I think when we talk about vapes and e-cigarettes, there's this common notion that potentially that is safer and therefore less risky than using the traditional cigarette. Because of that notion in particular in the AAPI community, that e-cigarettes are becoming more popular because they believe they're safer and they're less risky. And so we're going to talk about some of the truth behind that and some of the risks that are associated with using nicotine in general. In general, in the Asian American community, smoking is associated with lower English proficiency in the adolescence period. Asians break down nicotine more slowly than Caucasians and Hispanics. And so what that means is because they're breaking it down in their body more slowly, they have more nicotine in their body. So per cigarette, they're holding on to more nicotine. Some group differences, Korean and Vietnamese men have lower quit rates than other Asian Americans. So it's just something to keep in mind as we move through this. Dr. Truong. These are just breaking down the cigarette smoking prevalence in different Asian subgroups. As you can see, the highest prevalence is in Korean Americans, with the lowest prevalence being in Chinese and Asian Indians. And now we'll talk about some of the impacts of nicotine. So on a mental health level, when we're smoking nicotine, we are lowering the amount of oxygen to the brain. That will inevitably cause problems in learning and attention. The idea that that can potentially be related to suicidal thoughts then and impulsivity is not so far off. When we talked earlier, Dr. Truong mentioned that substance use and suicidality are so closely related because of that disinhibition. And even something like nicotine, which may feel more benign in comparison to some of our more illicit drugs, can also have an impact on our brain, our thinking, and our ability to be impulsive. Most common, I think, for the mental health piece is this anxiety and restlessness when we're not smoking a cigarette. So nicotine really acts on this reward pathway that we speak about when we're talking about addiction. And one of the key components of that pathway is that when we are not experiencing using a substance, we are thinking about it. We're thinking about the next time we'll be using that substance. The anticipation in some way really makes up such a large part of this. So with nicotine in particular, there's also an anxiety and restlessness that occurs between cigarettes that really causes people to really need that next cigarette within the next few hours. And that you might know that from some of the personal experiences you have in your life. Physically, we know that cigarette smoking can be linked to lung disease, cancer, and heart disease. Over time, when we have diminishing quality of lungs, we can have the exercise intolerance, trouble breathing, and potentially even further damage our lungs beyond just cancer and lung disease. What can happen with e-cigarettes? When we're thinking about e-cigarettes, we're hoping that they're safer, but we do know that they contain cancer-causing compounds as well. So similarly to cigarettes, they do have components in them that can cause cancer. What we also know is that in 2020, there was over 2,800 cases of e-cigarette vaping associated lung injury or EVALI, and that resulted in 68 deaths. So that's a number that's really important for us to keep in mind when we think about e-cigarettes as such a safe option, because it's not as safe as it might be perceived to be. And we want to hold that knowledge and education in mind when we're making decisions about e-cigarettes. And so just because they have the nicotine in them and the other chemicals, they can cause problems in learning, attention, impulse control, and mood. So I want us to keep that in mind. And now alcohol. Alcohol is a CNS or central nervous system depressant. So this is kind of contrary to what folks often believe, especially young folks, because the initial effect of alcohol is quite euphorogenic or exciting and stimulating. But over time, what we know is that as soon as that kind of dies down, that few hours of initial euphoria, that alcohol is quite sedating and depressing to our central nervous system. How do people use alcohol? Well, they traditionally drink it. They have for many, many years, beers, wine, liquor. And nowadays, especially with our younger kids, we're seeing a lot of seltzers with alcohol kind of as a component of those. There was a period where there was energy drinks with alcohol kind of incorporated into them. And so really, there's just a lot of different types of beverages, especially for our young people, that we need to think about. Here's a list of what a standard drink is. So half an ounce about it, or 12 ounces of beer, 5 ounces of wine, 1.5 ounces of liquor containing about 40% of alcohol. The American guidelines usually recommend no more than 14 of these standard drinks for a man in a week, or 7 of these standard drinks for a woman in a week. And in one setting, no more than 4 standard drinks at one time in one day for a man, and no more than 3 for a woman. So those are things to keep in mind as part of our American health guidelines. In the Asian American community, we really need to think about differences in genetics that make them more predisposed to alcohol intoxication or trouble medically with alcohol. And that's because of an inactive isomer of an enzyme that is involved in converting alcohol in our bodies. And so when we drink alcohol, it gets converted to different other products in our bodies so they can be metabolized through our livers. And 50% of Asian Americans have this isomer of aldehyde dehydrogenase that makes it much more difficult for them to metabolize alcohol in their body, which leads to flushing, palpitations, and nausea. Even with this reaction, there's still high alcohol use, particularly in specific subgroups like Koreans, Japanese Americans, and among Asian Americans with alcohol use disorder. This impact is just as severe as the non-Asian population in America. And what are the impacts? Mentally, alcohol is a depressant, so there's going to be depression. It's going to have some of that similar anxiety and restlessness in the withdrawal that we talked about with nicotine. Alcohol disrupts our sleep architecture, so we will fall asleep initially faster, but that second half of the night will be much more difficult. You'll have much less restful sleep, and it'll be really difficult to feel well the next day. That can lead to problems with learning, attention, and impulsivity, and the withdrawal can be quite uncomfortable and potentially dangerous. Alcohol affects all of our organs and can cause cancer, heart disease, and particularly liver disease. Even after one binge drinking episode, we can see fatty liver in some cases. So this is not a benign substance that we're using and is quite toxic to our bodies. Legally, an interesting fact is that the most common reason for Korean Americans in Los Angeles to be arrested is DUI. So this is a problem that's affecting our communities. Why do people use them? Because I'm not naming anything fun. Well, because they can be fun, or there's a perception that they can be fun and they can cause entertainment. And so when we're talking about young people and we're talking about adolescents, we're really talking about novel experiences, trying new things, doing it with their friends, feeling accepted and connected to their friends and their peers. With the e-cigarettes in particular, there's tons of different flavor options. People make up games or have fun kind of exchanging, trying different flavors. Peer pressure is a tale as old as time. It still exists. And especially when we're talking about things that people are perceiving as low risk, like, hey, try this e-cigarette, there's not really any harm associated with it. That can be kind of a dangerous moment for us to think about when we look at it medically. In this developmental stage, we want to be mindful that adolescents, their brains are not done growing and not done forming. And so they have not all of the wisdom and experience of us adults. Because of that, it makes it a little bit easier to fall into peer pressure, to want to fit in, to want to be accepted. Acculturation is associated with increased use. What's protective? What do we have that can protect our kids from this? Well, one is a higher academic performance, which is something that I think we all value and is an important piece of this, but there's other things too that we'll go over. And a piece of this that I think is particularly important for parents to keep in mind is that there is a relief of emotional pain. When people are using substances, they're often trying to escape a feeling that's negative or uncomfortable. They're often trying to change their mindset or move into an area that doesn't feel as painful as their current mindset. And so among Chinese and Filipino adolescents, there is increased alcohol use, and it is associated with low self-esteem. And so if you think about kids that really don't feel like they are belonging or they're doing well, there is a higher chance of those kids potentially experimenting with substances. Immigration is also a really important piece for us to keep in mind. There's a lot of stress that is associated with the process of immigrating, and there's feelings of being out of control, wanting to feel in control, wanting to have something that they can control, and substance use often plays that role. And so what are our tips for talking to loved ones about substance use? If you have an adolescent that is talking to you about the friends that they have that might be trying substances, or their curiosity to try a substance, the most important thing I think we can share with you is to come from a place of genuine concern and curiosity. What that means is to hold off on that shameful component that Dr. Truong talked about earlier, and to try to be really curious about why this person, why this kid wants to try a substance, and how you might be able to have a really open conversation about it. One of the first steps to doing that is to understand the role. Why do you want to do this? Is it because you're trying something new and your friends are doing it? Is it because people are pressuring you to do it? Or is something else going on? Are you feeling anxious or depressed? Did something traumatic happen? And are you self-medicating or self-soothing to move your mindset or mental state into something that's less painful? Being open and non-judgmental, I think, is the single most important piece of this slide. Find time for yourself as a parent to take care of yourself, to think about all of the different things that are involved in a child using substances, and then get some perspective on that. So talk to people, get educated, you're here, you're trying, and take a deep breath before each conversation with a child so that you can make sure you're being as open-minded and curious as possible and not coming from a place of shame or even anger. So grounding yourself in the goal of the conversation. I think what's most important when we talk about substance use is that because it's so common and so prevalent, especially in our youth, we want to remember that our priority is safety. So the more open and curious we can be, the more safe our children or adolescents will feel speaking to us about it. And how can you model positive behavior? You can take care of yourself. You can show your adolescent what it looks like to take care of yourself and not necessarily involve substances in that self-care. Getting help. So what do you do if you need help? That is a good question. There are plenty of resources in our community and in the community at large for you and your adolescents, but seeking them out is the most important step, and nobody can do that but you. The first step is to get help early. If your child is enrolled in high school or middle school, we can go to the school guidance counselor, and that would be a really good first step. But also finding culturally aware mental health professionals. So like Dr. Truong said, just because you use a substance a few times doesn't mean you have a substance use disorder. But if you're concerned that your adolescent is using substances and having potentially dangerous side effects to their life and impacts on their daily living, then we want to get some professional help. Psychiatrists and addiction psychiatrists and specialists are trained in that particularly, and therapists are really great options for if you want your child to have a safe place to talk, kind of a third party to air things out with and look at things differently with. If things get dangerous or if you're worried about the safety of your child, you can always call the crisis line. This is the number for the one in Harris County. It's operated through the Harris Center, and they're open 24 hours a day. And you can always bring your adolescent to an emergency room if you need to. And here are some websites for some resources, really great websites for specifically Asian American mental health. We'll have these kind of slides available for you so you can have this resource. I think that might be it. That's us. Thank you.
So I just wanted to summarize that this is an increasingly problematic situation in the Asian community, that we are seeing increased depression, increased anxiety, increased substance use, and suicide. So I'm so glad that we got a chance to discuss and talk with you all about this issue. And even though we focused primarily on alcohol and nicotine use disorders in this presentation, there are other illicit drugs like methamphetamine, opioids are also becoming increasingly prevalent. And other addictive behaviors such as gambling disorder is a major problem in the Asian American community. So we wanted to keep the slides short so that we can give you a chance to ask your questions and really have a conversation about how to tackle this issue.
Excellent. Thank you so much, Dr. Truong and Dr. Amin. We have a couple of questions that have come in. One of them is, in the chat, can you speak more about rates of somatization and culture-bound disorders? Also, if there's any information of normalization of intergenerational trauma.
Now, the research on the AAPI community is still very limited, so I can't really speak to the specific rates. However, it is very well recognized among mental health clinicians that Asian Americans often feel more comfortable expressing their emotions through physical symptoms, to expressing their physical symptoms, as sometimes that's may be seen as safer because it feels okay. Like if you have an emotional concern, well, that's not okay because all you have to do is change your mind and maybe you're weak. But if you have a physical concern, well, that's not really your fault if you have a headache or if you have a stomach ache. So it is very common, and sometimes speaking about potential emotional concerns through the body. So if I were, well, I am a clinician. So if I were speaking to an AAPI community member, I might say, well, tell me more about that pain. Like, have you noticed if there are any associations? When does it come on? So being comfortable with kind of speaking their language and meeting them where they are in the way that they talk about some of these emotional concerns. And can you repeat the second question about intergenerational trauma?
The second part of that question was, go back to it here. If there's any information of normalization of intergenerational trauma.
So there is, I found like one study done in 2019, despite, this being such a major issue in the Asian American community. And I will focus primarily on the substance use disorder and post-traumatic stress. So post-traumatic stress is associated with alcohol, drug, and tobacco use in the Asian American community. But what was interesting was that individuals with high shame, so if you're having post-traumatic stress symptoms and you are an Asian American and you have really a lot of shame, you're actually less likely to use substances. Now, this is actually opposite of the of non-Asian American communities, where high shame is associated with more substance use. We're still trying to figure out what this means in discussing these issues with the Asian American community. Really, the recognition has been that the AAPI community processes emotions, processes experiences differently, and the behaviors are manifested slightly differently from non-Asian Americans. Would you like to add anything to that, Dr. Amin?
No, that's what I was thinking about too. And I think I can just jump into the next question. Did you want to read it first, Andrea?
Sure. Because of shame, is mental health referral difficult? Would psych services integrated into primary care be more acceptable?
I was just going to make a comment on this. I think this is a really important question because it involves access to care and where to go when you don't necessarily feel comfortable seeking out mental health care specifically. Primary care is a really good gatekeeper, a really good in-between between not having any resources or connections to the psychiatric and addiction specialist world. There are some primary care models and clinics that have psychiatry and behavioral health built in. But oftentimes primary care doctors are seeing first line mental illness and also substance use disorders. Usually they will refer those to us when they need to, but sometimes they're able to handle them on their own or make appropriate referrals elsewhere as needed too. So I think this is a really good question. I think another really important piece of it is, instead of having to account for shame, how do we spread the idea that we need to lessen the shame and be more open and be more curious? And that, I think, takes a lot of effort and a lot of energy, but is something that I think as a community we need to continue to work to do.
And on that note, I got a question come into my email. How do we best open lines of communication between affected adult AAPI community members and their parents? As in, how do we deal with all that shaming?
You want to take this one, Dr. Truong?
Sorry about that. I was trying to find my mouse. This is a really important question, because shame in the Asian American community is actually seen as a positive emotion. It's generally seen as something that almost should be felt in order to regulate behavior. So to facilitate that conversation, first, I think it's important to acknowledge that shame may be actually important and perceived positively by the first generation or older generation of Americans. And acknowledging the conflict between more acculturated Asian Americans, so second, third generation Americans, who have essentially learned that shame is sort of bad and shame makes you feel terrible, whereas their parents may believe that shame is a good thing. It makes you do well in school. It makes you be successful. If you're not shaming, then what are you doing? You're not parenting. So that might be, so it's important to acknowledge the role of shame as possibly being both positive and negative within the AAPI community. And then I think helping the parents to understand the differences in what they faced versus the differences in what their kids face. And facilitating that conversation is going to be challenging. There will be defensive behaviors. But I think trying to, when I was working with an Asian American family, I certainly tried really hard to always remind people of the goals. So the parents, what are your goals? And it's always, I want my kid to feel better. I want my kid to be successful. I want my kid to feel loved. I don't understand why they don't feel loved. And so then using motivational interviewing, well, as a parent, what are you willing to do to make your kid feel more understood? And so sometimes the behaviors have to shift within, well, not sometimes, often. The behaviors have to shift within the family system. So both the parents and the child have to do some work. Any other comments on that, Dr. Amin?
No, I agree completely. I don't know if we all can see the Q&A. I just got an anonymous question. That I can go ahead.
That question that just came in is, would seeing Asian providers create a barrier for clients to speak more openly, or would it be more helpful?
Yeah, I think this kind of goes along with what Dr. Truong was just saying as well. I think it really depends on the person. There's, different interactions depending on what somebody feels more comfortable with. I think in my clinical experience, I've found in some cases, people feel more comfortable with Asian American providers or providers from their same background. And sometimes there is more shame there, and there is more of an effort to hide or conceal some of the truth behind what is probably going on. So I think that part really depends. But I think, just like Dr. Truong was saying, being really curious about where that shame is coming from, what impact it has on the family unit, and who feels what way about it, and how you can kind of be this mediator between all of those people and places and try to sort that out. I think that's the really important piece. So I think it just depends. I don't know, Dr. Truong, if you had any other thoughts.
Nothing else for me. I agree.
I have one that says, have you all seen depression, suicide attempts, etc., increase specifically in the AAPI community from 2020 to 2022 so far?
I personally have, particularly not only suicide attempts, more so suicidal ideation, and a lot of ambivalence about living. And I think this certainly has a lot to do with political affairs, the crimes against Asians that really increased between 2020 and 2022. And this isolation, social, emotional isolation because of the COVID pandemic. And I think sometimes Asian Americans it's like when you're thrown into such a state of affairs, like a pandemic, none of us have ever experienced this before. And without the emotional tools, the tools to express yourself, the tools to go out into the community and share your vulnerabilities, even online, they became much more isolated. And sometimes what I've seen more so is that Asian American youth are using like video games as a way of self-soothe. So they may not be fully expressing suicidal thoughts or ideas to anybody, but they are becoming more and more isolated and kind of getting engrossed in the online video gaming internet community at the expense of other activities, of course.
And just to add to that, such an important point on what to do instead. As addiction doctors, we're often talking to patients that have substance use disorders about what to do with that time if they're not going to be using their substances during periods of sobriety. And that's not much different than what we would recommend you do with your adolescent or your youth, is to find activities that might quench that boredom, that might help you connect together. So let's exercise, let's go on a walk, let's cook together, let's watch movies, doing things that feel like they're occupying time together, they're connecting, and they're creating more of a relationship for you to be able to be honest and curious with each other. I think is so important in a time where we are all locked up and alone. Just being connected, especially because you do get to be with your family. How do we make the most of that experience?
Excellent. Good point about connectiveness. I think we all need, to feel more connected, especially to our families. As a mom, what do I need to look for? What signs do I need to look for in my older teenagers to make sure that they are mentally healthy?
Great question. So I think anytime you see a significant change in behaviors, and I think we all know that generally during teenage years, teenagers and they're going through an adolescent period where they are trying to seek independence from you, and contrary to what they may be showing you, they do want connection. They want to preserve the connection while still exploring who they are. So their sense of identity, what they're capable of doing by themselves. And that is normal adolescent behavior. But I think when you start to see that they're really isolating the room almost all the time, they're upset with you for almost everything and really unable to express themselves fully about what's underlying. Or they're sleeping a lot. They may be going through withdrawal from substances, like having repeated hangovers. And so opening that line of communication. Hey, I noticed that I've noticed some of these changes and I'm really worried about you. Can we talk about that? Staying calm throughout this conversation. So some of those changes that I've noticed have been most common in youth, including Asian American youth.
Excellent. And then the last question that I have is, what educational programs exist regarding mental health and mental health issues for the AAPI community to reduce shame and stigma and to open up pathways for members of the community to seek help from other members of the community?
So some of the resources that I have here, they actually do provide a lot of educational programs, and I really encourage you to check these resources out. It's something that has developed actually from our own Houston community member, and it has really expanded to across the nation. There's a huge Facebook group called Subtle Asian Mental Health that I'm also a part of that has 60,000 members. And there's a Facebook group with Asian mental health professionals who are constantly trying to deliver educational material to the AAPI community. And there are like 5,000 of us in this group. I think some of us are here right now. So, so I would check out these resources first because they're easily accessible, and see how you can participate in that. At the same time, I think it's important to know that you have your immediate healthcare providers who, if you have someone that you can trust, even if they are not Asian American, and it's totally okay to seek out a specifically Asian American provider, but even if the provider that you trust is not Asian American, them being able to understand you from, a perspective of respecting who you are as a person can be tremendously helpful, and they're more immediately available and more local to you.
Excellent. Thank you so much again, doctors, for your time this afternoon. It has been a pleasure. If anybody else has any more questions, please feel free to reach out via email. And please join us for next month's conversation, taking place on Thursday, March 3rd at noon, for Understanding Guilt and Shame with Dr. Carrie Horrell.
Thank you so much, everyone.
Thank you.